Hello, my name's Mariah, and I'm going to be doing my project on lung cancer rates in Florida. And the reason why I chose this topic is because my grandpa had lung cancer and he never smoked a day in his life. So I found this topic interesting because I felt connected to it in some type of way. Why is this a community topic of interest? Well, it's the most common type of cancer, and it's a leading cause of cancer death. It makes almost 25% of the cancer deaths in the U.S., and each year more people die of lung cancer than of colon, breast, and prostate cancers combined. What is lung cancer? Lung cancer is when irregular cells grow in the lungs, and if it's not treated promptly, it can spread to other regions of the body. There's two types of of lung cancer cells, and there's small cell lung cancer, which is found in active and former cigarette smokers, and it's less common in more aggressive tumors. Radiation therapy along with chemotherapy is used, but surgery isn't used commonly because of the aggressive tumors. Now there's non-small cell lung cancer, which grows slowly and takes longer to spread. Surgery and radiation therapy are usually used, and chemotherapy is used to increase the effectiveness of surgery. Now, how lung cancer forms is lung cancer forms when cells in the lungs mutate, and in this process, it grows uncontrollably and clusters together to form a tumor. How lung cancer spreads? Well, lung cancer spreads when cells break off from the tumor and travel through the bloodstream and lymphatic to distant regions of the body and grow. And here you have the primary lung cancer tumor right here, and it spreads to the liver, to the bone, and the brain in this picture. Now you have Florida's rate of lung cancer, and that is 58 incidences per 100,000 people, which is average year for the nation. Here's the rate of new cases by racial and ethnic groups. As you can see, white Americans look like they most commonly get lung cancer, and especially in Florida, it's above average than the nation, which is pretty interesting. And for the survival rate in Florida, you have only 24.1% of people still alive 5 years after being diagnosed with lung cancer. And in this picture, it shows the percentages for the stage of diagnosis and 5-year survival. Your vulnerable population would be smokers, people who are around smokers or with smokers, and past cancer survivors that had radiation therapy. Family history of lung cancer can make you vulnerable as well, and people who are exposed to certain substances in a work environment such as asbestos products, arsenic, diesel exhaust, etc. Common problems of lung cancer is anticipatory grieving, situational low self-esteem, acute pain from the pressure of the growth, altered nutrition, and risk of fluid volume deficit, and fatigue, and fear and anxiety. Signs and symptoms is coughing that gets worse and doesn't go away. There's chest pain, shortness of breath, wheezing, coughing up blood, feeling very tired all the time, and weight loss with no known cause. The type of care you would give is encourage deep breathing exercises, and you can position for best lung expansion at 45 degrees, and you can use oxygen and medications to control dyspnea, and you want to encourage oral fluid intake, 2,500 milliliters per day. The perceptions of using mindfulness therapy is a focus group study on lung cancer, and they have 11 lung cancer patients that participated in this study, and it just helps the patient's health-related quality of life. And according to Lento, Mindfulness-based therapies are showing promise in modifying psychological distress and improving health-related quality of life among patients with breast cancer and in mixed cancer groups. Primary prevention is avoiding smoking, eating a healthy diet, exercising, avoiding carcinogens in your work environment. And for your secondary prevention, this is catching the cancer early. So you're going to go to health screenings when you're still healthy and feel healthy. And if you do have that early stage cancer, you can have either surgery, radiation therapy, or chemotherapy. And then you have tertiary prevention, which is when you have the cancer for a while and you can use the rehabilitation after surgery and palliative care to slow the progression of your cancer. And to support a family member or friend with lung cancer, you just need to support their feelings, avoid changing the subject when it's uncomfortable, and assume your family member or friend can hear you at all times, even if they're sleeping or dazed off. And avoid offering medical advice as well. And always call before you visit. Here's my reference page.